Namaskar, good evening, Assalamu alaikum, and welcome to you all on behalf of J&A Bharat HSC Foundation and J&A Global HSC Foundation for the 44th Outreach and Knowledge Transfer OKT webinar on managing chronic conditions through nutrition, health records, and coordinated care, being presented by 2Care Foundation from India. And we'll also be announcing the J&A Bharat HSC Foundation Scholarships 2025 recipients as part of this webinar. So today is 26 November 2025, Wednesday around 20:30 p.m. in India. And let's move forwards. Before we start our meeting or webinar, we would like to have a brief tips for the successful meeting. Kindly mute your microphone and raise the hand whenever you want to speak. Switch off your camera and switch on when you want to speak. Post your queries, comments, suggestions in the chat box, as well as please introduce yourself in the chat box with the name, designation, company, or college if you're a student. And please stay for the ceremony group photo at the end of the vote of thanks. And again, you can copy the meeting link and share with your friends for joining. And with that, as I just want to tell you that today it will be two-part agenda. The part one will be the introduction, welcome address, and we will also be briefly talking about the India, Safety Engineers Association of India, and our foundation's award program. In the part two, we'll be talking about the managing chronic conditions through nutrition, health records, and coordinated care by 2Care Foundation. We will have a more introduction by Mr. Dinesh Kumar Paul before we start the program. Then we will be having an announcement of J&A Bharat HSC Scholarships 2025 recipients. Before that, I would like to introduce our role players of today from our foundation. Mr. Dinesh Kumar is chair for the HSC Leadership and Communications. Dr. Produturi Lakshmi Narayan, he will be Q&A moderator of the session, technical session. And Mr. Adavi Balashiva Srikanth, he will be introducing the keynote speaker of the day. He is our chair for the awards and honors. And Professor Ramana, he is a student a scholarship chair, and SP Rangacharilu is our chair for the fire and safety community awareness. So, and also we have our J&A Bharat HSC Foundation advocate from Tamil Nadu, Mr. Dakshinamurthy. He is also one of the person for coordinating the scholarship program. With that, we would like to introduce and welcome address by our founding trustee, Mr. Jeetu Patel. As we were talking before we start the program, Mr. Jeetu Patel has got a wide experience in the field of health, safety, environment. 60 plus years of his life has been spent into health safety profession. And he is the one who established the ASSP, which is American Society of Safety Professionals, US, outside US in 1981. And Mr. Jeetu, please do give your welcome remarks. Mr. Jeetu, are you on the mute? Let me check. Mr. Jeetu?
Yes.
Yeah.
Now I'm with you all. I apologize for my blunders, but thank you, Ashokji. Good day and namaskar to all. I really respect all our honored guests and our today's respected guest speaker, Dr. Mridul Rampal, founding team of 2Care Foundation, Indian Army representation, Dr. Diksha Sharma, clinic nutritionist, Dr. Paman Toshin Niwal, co-founder of 2Care, and Dr. Sakit Toshiniwal, whom I have had pleasure to talk to on telephone conversation through my friend Dr. Nilesh Mehta, and he is also the founder partner of 2Care. And I am delighted to warmly welcome also Professor Dr. Anand Sonatek at National Fire Service College, Nagpur, Home Affairs Ministry, Government of India, respected Professor Ramana Garu, Dr. Lakshmi Narayan Garu, Mr. Ram Prasad Garu, Mr. Selva Ganpati, who is the past president of Safety Engineering Association, Mr. Rao, M.S. Rao, Mr. Alok Chatterjee, and all the corporate dignitaries, including faculty and educators from various institutes and universities, and all my dear friends and colleagues, HSC professional leaders. Plus, importantly, I welcome warmly to all the scholars who are the recipients of the 2025 Scholarship Awards with the distinguished delegates. On behalf of J&A Bharat and J&A Global HSE Foundation, a very warm welcome to you all. And I take this moment to reciprocate my dear friend Ashokji's outstanding introduction to me. And now I say this, that everyone knows this great friend of every one of us, who is a co-founding trustee of J&A Bharat and J&A Global Foundations, and Mr. Gallapati for his remarkable contributions to the HSE profession, who has developed countless numbers of HSE professionals globally. I'm proud to add as that Ashokji was recognized by the Board of Certified Safety Professionals at their recent meeting in Edinburgh, Scotland, for his remarkable and significant contributions in advancement and development of the profession globally. As a BCSP director for 5 years, from 2020 onward till today, he also served as vice president in 2023, president during 2024, and has successfully completed his presidency, making remarkable contributions there, and currently as its 2025 past president of BCSP as an advisor. He was also recognized with the most prestigious and the highest Fellow Honor Award offered by American Society of Safety Professionals, which is the oldest and the largest health and safety professional organization. He is also a fellow of IOSH in the United Kingdom. And that says it all. Ashokji, could you please do us an honor of conducting the proceedings of today's webinar? The floor is yours, sir. Thank you.
Thank you, Mr. Jitu, for a kind introduction. To have a brief background, because we have there are so many guests attending first time, so we wanted to give a little background by both of us who we are. And moving forward, as you see the world map there, little flags there, we have been working together almost his 60 years experience, my 30 plus years experience. With that experience in our HSC profession, we have been supporting the international members so well, and we were instrumental in establishing ASSP chapters in different parts of the world, including in India. And we wanted to do something more because there are so many professional organizations, but still the accidents are happening. This is the ILO, International Labor Organization statistics. Unfortunately, India is on the top of the list. So we wanted to do something more. We wanted to bring the concept which is being practiced around the world, but it's not available in India, which is HSC Foundation. So there are so many professional organizations, the charity-based organizations, specifically in the HSC field. We wanted to establish during the COVID time. We established on 25th March 2022 virtually. Further, we expanded to the global outside India with the name of the J&A Global HSC Foundation, registered in US on 30th November 2022. Our foundation is not at all a membership organization. It is a fraternity, we call it. We do not charge anything. We only give it back in terms of the knowledge, in terms of the financial support, in terms of the professional development grants. We coordinate with the professional organizations, corporate organizations, associate institutions, and philanthropists and individuals, the NGOs as well, like True Care Foundation. Today we are collaborating. Our mission and vision is very, very simple: to support the HSE profession as well as the HSE professionals, and also do the advocacy in the field of health, safety, and environment profession. Our objectives are advancing the profession, to support and promote occupational safety health as a career choice among students, which our keynote speaker will be emphasizing on that, the importance of HSE profession with a specific view to the students. And we also objective is to inspire and develop leaders, to provide education and developmental opportunities, and recognize the individuals, as well as to conduct community awareness programs, affiliate with any university institutions. And we also have a agreement or MOUs with the organizations having the similar objectives, like Safety Engineers Association India, which we are coordinating on the award program this year. And we also have several activities, and which is available in our website. We have introduced the e-newsletter by Mr. Madhu Nallan Chakravarti as the chief editor, and Dr. Lakshmi Narayan as a editorial board member. From almost 10 months, we have been issuing this particular newsletter. It's electronic newsletter. You will find all the information in our website as well. So on the right side, you see the stepwise infographics. All the activities and programs are available there. Because we have a shortage of time today with the 2 programs in place, because our students also going to speak little, the recipients of the scholarship also is going to speak. So we would like to move forward with our today's session with the technical session. Before that, we just want to tell you that this year we are collaborating with the Safety Engineers India, which is based in Chennai and Tamil Nadu, and in collaboration with the Safety Engineers Association, we announced the HSSC Excellence Award, Safety Innovation Award, Individual Excellence Award. All the information is available in our website as well as C India website, and so much of information is there. We are going to share the more information during the open discussion, but we just wanted to make this announcement. So we're moving forward with the part 2 of the agenda. We'll be focusing on the True Care Foundation concepts and how they are going to help the community, by using the artificial intelligence as a tool. Before we hand over the floor to them, I request our Mr. Dinesh Kumar. He is our chair for the HSC Communication and Leadership Skills, and he'll be introducing the True Care Foundation and the speakers of today. Mr. Dinesh.
Hello, HSC professionals and respected founding trustees of J&A Bharat and J&A Global HSC Foundation, and distinguished panel of doctors, all student recipients of the scholarship, and good evening, everyone. Today, we are honored to host a remarkable team from the True Care Foundation and TrueCare.ai, individuals who are not only experts in their fields, but also passionate change makers committed to improving the way chronic conditions are understood, managed, and supported. Their mission beautifully blends healthcare, technology, empathy, and real-life caregiving. Something all of us at some point have the needed or will need. With that, allow me to introduce our distinguished speakers. First, we have the Dr. Mridul Rampal, a founding pillar of the True Care Foundation, whose guidance, wisdom, and vision have helped shape the organization's meaningful and the human-centered approach to chronic health support. Next, we have Dr. Pavan Toshniwal, co-founder of the TrueCare.ai, an engineer, an innovator, and a caregiver who turned the personal experience into a mission to create AI-powered solutions that make chronic care simpler and smarter and more accessible for families. And joining as Dr. Saket Toshniwal, co-founder of TrueCare.ai, a technologist dedicated to the transforming healthcare system into the tools that are not just advanced, but usable, compassionate, and truly patient-focused. And finally, completing this powerhouse team, Ms. Diksha Sharma, a clinical dietitian and functional nutrition specialist who designs personalized nutrition pathways for individuals managing chronic conditions, proving that food is not just fuel, but sometimes the best form of the medicine. Ladies and gentlemen, please help me warmly welcome our distinguished speakers to the virtual stage. And with that, let me, who speaker will come first, Ashokji?
Yeah, we will hand over to Saket ji, then he will lead
Okay.
the
So,
session.
Saketji, floor is yours. And audience, please give a round of applause. You are the virtually or the physically, whoever the unmuted.
Thank you so much, Ganeshji, for the warm welcome, and G2G and Ashokji for having us on the virtual webinar to share our wisdom and the things that we have been building with together with the rest of the team here. So I'll get directly now to the point of why managing chronic conditions with the help of nutrition is important, and more so, of course, how we are doing it. But more importantly, I would also have um, uh, Dr. Mridul and Dr. Disha talk about this in a moment. So let me firstly start with uh, the let me know if you can see my screen, managing chronic conditions through nutrition. Great. So, as everybody knows, that as much as important it is to take medicines while managing chronic condition, it is equally important to have your health records to take the right set of nutrition and coordinate care. Today, 2 hours ago, we had this webinar for a lot of patients who have amyloidosis, which is going through multiple organs of cancer. So, for them, having their health records in one place, having functional nutrition, and connecting all of this information becomes extremely important. And henceforth, today we are going to talk about that and get a little bit more deeper as to how this all works. So when we started 2K.AI, it wasn't key today we just start a company or we start a foundation. It was really after spending 76 days in hospital when our father was diagnosed with cancer and we had to go into hospital by hospital, Apollo, um, Tata Medical, and Parkview, get all those different reports, get the diagnosis, pull in the information, put in those Excel sheets, and across those files, portals. Today, if you think about when you receive your what reports from a lab test or you forward it to doctor, where does that happen? It happens on an app called WhatsApp. Today, all of us use WhatsApp to manage chronic conditions to forward reports. But WhatsApp doesn't necessarily create your chronological historical record, and which gets lost. And for a chronic patient, that's extremely important. We realized the system wasn't broken, it really actually did not exist. So your records are scattered. You're getting every time a chronic patient is going to the doctor, whether it's nephrologist, oncologist, it's a very common question that they ask, "Ki khane mein kya khana?" or what to eat in the meals. And then they would get some advice or generic advice which they would not follow or even follow, or then it would get lost. So here we also enable how you get personalized based on the nutrition and your conditions, all the kind of diet. So how 2K.AI works is we have a unified EHR along with uh, are you able to see my presentation just to be sure?
Yes, we can see
Okay,
it.
great.
Yeah.
So unified EHR along which is owned by the patient along, and all the data is owned by the patient. So and then you have all the insights that you receive, whether it is labs, reports, flags, and then you have clinical oversight with the help of doctors and nutritionists, and then you receive the care on your WhatsApp every single day. Now, before I actually just go and talk more and more, I'd rather show you a quick demo of how the um, product actually works, along with how the team works to solve this. I hope you can see my screen. So as you can see that, people that use WhatsApp to upload specific reports. They get all the analysis on the report, and and not just that, but as soon as people upload reports or analysis, they can chat and ask questions. More importantly, their dashboard, as soon as you do, their dashboard gets created within seconds, along with the alerts based on their records, reports, prescriptions, scans, biomarkers. And if you have to understand what does it this report mean, you can ask in WhatsApp. You can have your personal link of what this is, along with the along with what questions to ask to the doctor, along with the original report. You can also see all your reports in one single place, and you can ask Maya about anything that you may have in terms of question answers regarding the report, and Maya will answer regarding your historical record. And we have created this AI engine. It's very important that all historical records of the patient is clearly understood and seen at a single glance. So whether it is 2025, 2021, doesn't matter how old your data is. People have uploaded over 600 reports even to get the analysis. A very common thing with chronic conditions is forget to take medicines, or the medicines gets changed. So we have reminders on WhatsApp, which based on the prescription uploaded, you directly receive the reminders on WhatsApp about medications, about the diet, and all of the prescriptions across the different specialists that you have can be seen into one prescription. You can chat about the prescription, and we have a team of doctors, dietitians that you can always speak to and can be your supporting uh, uh, pillar to support you. On that note, I will now pause and give the floor to Dr. Mridul Rampal, who will take us forward to explain um, um, on about how clinical and medical things combine with 2K.AI. I hope you were able to see the dashboard that I had presented.
Yes, we have seen that. Yeah.
Okay, perfect. Thank you. Over to Dr. Mridul.
Good evening, everybody. I am Dr. Mridul, and I've been with 2Care since quite the start. And to be very honest, I am the clinical part of 2Care, but also I am a very avid user of the same, as I am managing my grandparents' health through the same the same app, because they're also dealing with a lot of chronic conditions. So 2Care helps me do that as well. So Saket, if you can just go to the slide that fourth one. So I'm going to share some insights on how the platform works, as very well shown by Saket. I'm going to tell you the doctor side of it and how 2Care helps in managing chronic conditions. So,
are you able to see my screen?
Yes, we're able to.
Yes, sir, we can see, but I prefer if you can go the slideshow, so it will be the wide visual for the audience.
Yes, I will do that for sure.
Thank you, sir.
Yeah, thank you. Slides.
Okay, top left.
This
top left. Yeah, right side on the from the Zoom.
Oh,
right पे है.
Is it play?
Play के left पे. No, yeah, that's good. Yeah, that's good. Yeah.
No, I don't think so. 1 second, sorry.
Is it a PDF or PowerPoint?
It's a keynote. I will just do it. It's fine.
Yeah. Okay. I think it's you are showing the PDF, looks like. Other virtual, a few view full screen, you can go. Yeah.
Okay. Yeah.
File view full screen.
View full screen. That's right. Yeah, I think now it is better.
Share it again.
Yeah. Is it better now?
Perfect.
Thank you, sir.
So, as Saket already mentioned about EHR, EHR is electronic health records, and it's basically, as we all know, I think in India and across the world, we don't have EHR like everything at one place. So what 2Care does is whenever you upload your report, as Saket told, be it 2020, 22, all your reports are at one place. So as a doctor, the first thing that we want, say if you're a patient and you come to us, the first thing that we'll take is history. That's the first go-to thing. History taking is the way to go, so that we can understand what your health has been like, and then we'll come to a diagnosis. So with that, what with the EHR that comes with 2Care is that whenever you go to any doctor at any hospital, you can take that EHR with you with the magic link, or you can take it with you with, like, the doctor can also log in and see your details if you send him the OTP. So what happens there then is that you don't have to firstly carry your entire file folder and data with you. It's just a simple website which you can open. Also, when you go to different specialities, because now everybody wants to go to different specialities, say you're going to a kidney doctor, a nephrologist, say you're going to a cardiac, you're going to a diabetologist, you still have to carry everything, but you don't have to do that. You can just give them the link, and then also you can't you also don't miss a certain point. Say for example, if you're going from A to point A place to B place, and then you miss something, doctors in India and also I think everywhere, doctors are really busy, and then you get a certain appointment, and then you missed a document, and then you can't go forward. So with 2Care, that doesn't happen, because everything is organized at one place. Secondly, whenever like you're dealing with chronic conditions that I've already told you, my grandparents are also chronic, having chronic conditions, conditions like hypertension, diabetes. These are the smaller ones, but these are as you have to care for it, or the bigger ones like cancer. So what happens is your immunity goes down. Once your immunity goes down, you have to see a doctor, say for fever, for diarrhea, for very small issues. With 2Care, what we have is we have a set of panel of doctors who are GPs as well as specialists. What we can do is, sitting at your home, you can just call them. It is 24/7, 365 days. You can call them anytime you want. If you have any problem, they can give you a prescription, and then we can go forward. So you don't have to go to a hospital or a doctor every time. Then thirdly, there's a psychological burden which basically comes with every chronic condition. Like I think that managing anybody's care is 50% mental, and more than 50% actually, and 50% physical. So once you have a chronic condition, you're always thinking that what is going on in the body, what is happening, I'm losing weight, I'm lethargic, I don't know what is happening. You have so many questions, you have so much of anxiety. Depression is also common, and all of those things. So we at 2Care give you compassionate advisors from the doctors that you have. I am also in the panel where I also have a lot of patients with me, and the thing that I have gotten from my patients is that they say that nobody listens to us this carefully, and nobody gives us this much time. So that is also something which we want to do, and this helps in the growth and the recovery of the patient physically and mentally. And then lastly, I would like to say that why the coordinated care matters is that there's nothing which is missed. So basically because the pattern is very unified, and it is we can't overlook anything. It's just everything is present in one place. So it is very difficult to overlook or miss something. So, and that's the key. If we find that today your sugar levels are high, you don't have to wait 3 months and then accidentally find, oh, that I have high sugar, and that by that time it is probably a little too late, and you'll have to have many more medicines. Saket, if we can go to the next slide.
Yes. Thank you.
So we also have something which is remote patient monitoring, which is we give you a link every day, or actually, if not that link, like Saket said, it is all on WhatsApp. So for example, if if you're a BP patient, if you're a hypertensive patient, and if you've checked your BP today, you can just take a photo of your BP machine, and then that photo can be sent to the WhatsApp Maya AI, and that will be in your dashboard. What that does is, and it is across everything: BP, sugar, your SpO2, your weight. So what that does is, if that parameter is not in the range, it will give an alert to the doctor and to the family member that you have assigned. What we can do with that is that we can prevent any emergencies. We can prevent, like we can diagnose something much earlier than as I told you, say BP, hypertension, diabetes, or any sort of disease. We can diagnose it much earlier, and that is the key for our for health. Basically, any type of cancer, any type of disease which we can prevent or we can diagnose earlier, that's the key to a better treatment and a better life ahead. So, next slide, please, Saket. So as I was saying, prevention. So there's three kinds of prevention. I don't want to go into a lot of detail with this because this is a lot of medical, but the three types of prevention is basically around risk factors. So we can prevent anything from starting with there's no risk factor. Say, for example, if there's a risk factor for hypertension, which is, say, obesity. So we can start before that as well. And if somebody is obese, then we can start to not lead them into any hypertension or any chronic condition. If somebody has a chronic condition, then we can also manage them so that they don't land into complications. For example, tertiary prevention, if we say, if somebody already has a chronic condition like hypertension, we
Please go ahead, sir. Please go ahead.
Yeah, sorry. So say, for example, if we have hypertension, what we do is, with constant medicine reminders, with constant follow-ups, we do not want your organs to get damaged. So there's prevention in every aspect and every level which we can follow up. So it helps a lot for the disease progression. And we can also help if there's no disease. We don't want you. So I have patients who are 30-year-olds who are very healthy, and they're uploading their reports every 3 months, every 6 months, so that we can get to know that they're not landing into trouble. As we all know, our lifestyle is getting there are a lot of lifestyle issues at the moment, and people of 25 years or 30 years are also getting myocardial infarction, heart attacks, and we're losing them. So we, with this, can also prevent such kind of things. So it is for everybody, for somebody who's 30, for somebody who's 60, somebody who's 30 who's very healthy, somebody who's 60 who's has one chronic condition, and somebody who's 80 who has multiple chronic conditions. So we are helping them all to just forget about their health and just be there for them so that we can give the care that they deserve. Next slide, please, Saket. In the next slide, there's just a few examples of how the outcomes have come, that we've averted some heart failures, or a kidney patient has gotten the dialysis has been delayed, or the HbA1c has come down from a customized care plan. The customized care plan includes the doctor and the dietitian. So now, without further ado, I just would like to give the mic to Diksha, so that she can explain how diet is a part and helps managing chronic conditions with, obviously, 2K.AI. Thank you.
Good evening, everyone. So myself, dietitian Diksha Sharma, and I'm a clinical dietitian and as well as a functional nutritionist. I'll just quickly share my screen.
Also, sorry for interruption. Doctor, I request just you can flip down the laptop screen so you will be fully visual. Because now I can say only the neck. लैपटॉप की स्क्रीन थोड़ी डाउन कर लीजिए अपनी तरफ.
It's okay. Let's leave.
Yes, like that.
So, to start with, how functional nutrition plays a crucial role in all the complex chronic diseases. It could be anything. It could be cancer, it could be myeloma, it could be amyloidosis. So, starting with these all are inflammatory diseases, and they suppress the immune system, and they also dysregulate the mitochondrial functions. So mitochondria, we all know, it's the powerhouse of the cell. So its dysregulation starts to happen when there are chronic diseases happening to the body. Now, functional nutrition, how does it play the role over here? It restores the biochemical balance, and the toxins that are accumulated during these diseases, it reduces that, and also it can support the organs along with it. So here I can give you an example. Let's say there is a cancer in the liver. So now functional nutrition can support other organs like stomach. It can support kidneys, so that there is a very regular function of the bodily actions. Other than that, it targets the roots of the diseases, that is generally the inflammation, any oxidative injuries there, or there is immune dysfunction, that is basically not proper functioning of the immune system. And gut dysbiosis as well. Gut dysbiosis refers to the disbalance between the good bacteria and the bad bacteria in the body. So I'll just give you a clinical example of it. So let's say that there is a patient of myeloma who is experiencing extreme fatigue and also has sarcopenia. Sarcopenia is basically muscle loss in one's body. So now, with the help of functional nutrition, we'll optimize the protein of that particular individual. We'll add micronutrients into the diet, which will eventually increase the strength and will accelerate the recovery phase of that individual. Now, inflammation and oxidative stress. Now, how does these two things affect the core mechanisms? So, conditions like multiple myeloma and solid cancers exhibit high inflammatory actions and also oxidative burden. Now, functional foods are there like curcumin. Curcumin is the active compound of turmeric. So, when we include the functional foods into the food items, then we can definitely manage these particular chronic diseases very well, along with the medications and the clinical aspects that are ongoing apart from that. So for example, let's say there is a patient who is having his chemo sessions. Now post chemotherapy, this particular patient showed lower results of CRP, which is an inflammatory marker again. Now, due to which there is improvement into the appetite, then we can surely add anti-inflammatory diet, and we can add antioxidants into this particular diet's individual, so that the body is supporting well the other organs also. Okay, so these all things can be inculcated. Then again, gut immune and microbiome access. So gut immune and microbiome access is very important, because 70% of our immunity lies in our gut. So we need to take care of the gut first. Now, dysbiosis starts to happen in the gut, which is, I told earlier, which is the disbalance between the good bacteria and the bad bacteria in the gut, right? Now, when dysbiosis starts to happen, treatment tolerance is reduced, inflammation starts to happen, and there is an impaired immune function. The chemotherapy, the immunotherapy, and the steroids, all of these, they just disrupt the gut access completely. Now, functional nutrition will add microbial diversity. With the help of functional nutrition, we can add prebiotics, probiotics, synbiotics, all the glutamines, all the essential nutrients that are needed to support the body. clinical example can be, let's say there is a cancer patient with mucositis and diarrhea. Now we can add a gut healing protocol over here. We can add various strains of probiotic like lactobacillus reuteri, we can add lactobacillus rhamnosus, other strains of probiotic can be added, which can improve the nutrition status of this particular individual. So functional nutrition goes to the core of the disease and heals it. It's just supporting the other organs to fight that particular disease that is happening in the body. Now, functional nutrition, how it plays a crucial role in, I've taken here 3 examples. First one is amyloidosis, and second one is cancer, and the third one is multiple myeloma. So now, for amyloidosis, we can support the cardiac health, the renal, the GI system. We can support all of this by with the help of a low sodium diet and anti-inflammatory food items and high quality protein, because a high quality of protein that will give high biological value of protein. This will absorb faster and then again support the body. We can add enzymes like CoQ10, vitamin C, vitamin E, and polyphenols. Other than that, when it is the case of cancers, we can support the immunity and we can build the treatment tolerance in that particular individual, because chemo sessions disrupt the gut immune. So we need to add food items which can add the treatment tolerance. Then when it is the case of multiple myeloma, so bone strengthening nutrients need to be added like calcium, vitamin D, magnesium, and other anti-inflammatory foods. Now, how functional nutrition contributes beyond the calories. So it focuses on nutrient density as in not only on macros, but also the micros. Okay. And apart from that, anti-inflammatory compounds are added into the diet, and metabolical flexibility is also looked upon. Therapeutic foods are added like omega-3, omega-6, which we are generally deficit on. Antioxidants are added, probiotics are added, symbiotics are added, prebiotics are also added. Also corrects the micronutrient deficiencies, which play a very crucial role when a person is on the healing path of the particular medical concern, or even if they are dealing with any certain medical condition. If there are micronutrient deficiencies, that can actually worsen the chronic disease. And we also make sure that there are personalized protocols, because for every disease there is a personalized approach, so there is a sustained remission, and thus it improves the quality of life. Now, how functional nutrition along with true care, it promotes the health. So when there is a remote patient monitoring, a dietitian and a doctor both can see the weight trends, the vitals, the ECG, and all the parameters at one place, which enables to make a sustainable treatment solution for the same. So I have attached a screenshot below, if you can see. So these are the blood tests of one particular case. We can see how dates are listed over here. So it becomes easier and we need not to track here and there. We need not to look upon reports every time, like what were the values. Once we enter the values over here, we have to just do it through Maya, that is our chat bot. We have to just do it through it, and then the records are automatically mentioned over here, and we can see it through the help of the graph. Now, with the help of electronic health records, with the help of nutrition, and of course, doctors, when all of this is combined, a coordinated care is there, the patient's health is always improved, because all of them are on one page, so they can come to a very good decision. This 2care.ai has also helped to diagnose or to identify early warning signs of anyone's medical concern, like weight loss. So weight trends are there. Once the graph starts to decline, then and there we can help the patient for any of the medical concern if it is there. Let's say it's a cancer patient and weight loss has started. We can then and there take an action to help the patient to just stabilize the weight. Then appetite decline can be identified. Any GI dysfunction is there that can be identified. So, with the help of this functional nutrition doesn't only become just a mere thing, it becomes therapeutic, it becomes data driven, and it is very crucial in advanced services. So, that is all from my side.
Thank you. Thank you so much.
Thank you so much, Diksha. That was a really great, comprehensive from the side of TwoCare. If anybody is interested to know, have their customized diet plan, or you can, I've put in the form in the chat. Feel free to fill in the form, and this would be absolutely at no cost, absolutely free, and we're happy to onboard you, your family. So yeah, we're happy to support here. Please get in touch with us. I'll also put down my the TwoCare AI number, so you can always message us, call us, and I believe there are two questions that needs to be answered. I'll let Diksha or Dr. Mridul answer.
Yes, sir. Dr. Saket, thank you very much. And in fact, I am one of the user of your TrueCare AI, and Maya has given me the right advices so far. I'm planning to upload my mother's documents also soon. But before that, let's invite our Q&A moderator, Mr. Dr. Lakshmi Narayan Prodhitur, our Chair for Health and Wellbeing Education. Dr. G, please go ahead. I understand two questions are there, or from your side.
Thank you, Ashok. Thank you, Ashok, and thank you, the audience. Thank you, the Saket and other team members of Care2I. Then let me see. Actually, I have a few questions, but before that, let me check whether there are any questions in the chat box. Then maybe I can respond with my questions. Yeah.
You can go ahead with your questions, sir. Yes.
Yeah. Okay. It's interesting to note that even Ashok is already subscribed to this particular AI module. Okay. Now, my question is actually, see, maybe Ashok also can answer, unless he has not yet started, of course. See, for example, will not there be a conflict in consultations from the app consultation and the physical consultation? That's one question.
Right.
Yeah, Mr. Rampal, Dr. Rampal, can you answer? Or
yeah, Dr. Rampal would be the best person to answer this.
Yeah,
if I can understand your question, so we're not creating any conflict. We are just an added layer. Say, for example, if you go to your family doctor, we would not be involved in that. Once you come from your doctor, you can upload your prescription over there, and we can then work on it. If you have any more questions, we're happy to help. Yes. If there is something that you are skeptical about, then we can think about it. But we, in no term, as I am also a doctor, I would never say that doctor, whatever he said was wrong, or he or she said was wrong. We have full faith in your doctors as well. We're just there for, but like we're there for just like an added layer. We're not replacing your current system, but we're just an added layer.
Yeah, something to complement, you mean to say?
Yeah. Basically, yes.
Yeah. Right.
Yeah.
In fact, it has given me the same answers which doctor has given me the advice from my reports. Yes. Yeah.
Okay. Okay. Coming to the AI part of it, whenever we talk about AI, either ChatGPT or maybe other AI interventions, there's always all AI tools come with a disclaimer. So what do you have to say about that?
So even if you go to our website, it basically say, for example, if you upload your report, there we have colored markers there. So say, for example, if you uploaded a report, it will be analyzed by the AI first, and then it will show a yellow dot. That means it's analyzed by AI. Then a real doctor, say for example like me, I will analyze that, and then it'll be green. So we know that the AI is not 100%. I would say not even 100%. It will hallucinate. It will give out something which is not true. But because it is health, and health is like super important, so it is always basically vetted by a physical doctor who will go check your reports and then move forward. And if it is just an AI report, it will always have that disclaimer that this is an AI generated report. Please consult with a doctor. So,
Okay.
and then we as doctors in TrueCare are always available. So if you have any doubts, you can just reach out to us.
Okay, that's good. Yeah. I think these are just the thoughts which I had. So I think let me check the audience.
I was putting in the chat box that the functional nutrients our doctor was talking, but
Yeah.
how do we know that our micronutrients or functional nutrients are deficient? I mean, from the tests only, or is there any other way we can see?
Okay, so I think for all of these things, blood tests are, of course, one of the ways, but signs for micronutrient deficiencies are also there. Like if there is tiredness, continuous tiredness in the body, early morning when the patient is waking up or any individual is waking up, is feeling lethargic, definitely vitamin D3 deficiency is there. So these deficiencies can be figured out through physical examinations also, but the correct way is through the tests only.
Okay. Thank you, ma'am. Mr. Bala has got a question, looks like. Go ahead, Bala.
Yeah, thank you, doctors, for making a great session. I just wanted to know all these kind of the counseling things only for the patients or only for as a preventive measures for the good healthy gentlemen also, ladies and gentlemen.
Absolutely, it's for like healthy individuals as well. As I told you that I have friends who are paying to be a part of TrueCare, and they're all healthy. It is just like you can also have, because you have all your records at one place, so you know they also get their test done. So it's for 20-year-olds, it's for 40-year-olds, it's for 60-year-olds, it's for 80 years old. Just that everybody has a different use case, and it'll be very personalized in that way.
Okay,
Dr. Rampal, I do periodic examinations. I recently uploaded one. Can I upload my previous reports and it can create a history of that?
That's exactly where most of the users take the most value out of. They upload not one, two, but hundreds of previous reports to get all the chronological and longitudinal view of and the analysis and the alerts. So the more and more reports, prescriptions, and the data that you put in, the better the alerts. They will, like, for example, I'll give you, this happened literally 2 weeks ago. There was an patient who came, cancer patient, who came back from chemotherapy, got an alert to and uploaded the report and got an alert to see to the cardiologist. Why would somebody get an alert after a chemotherapy? And oncologist has already seen the report, right? In spite of that, Maya gave an alert because a year ago, with the same, he had the same chemotherapy and certain biomarkers were elevated when there was a heart complication. So Maya gave the alert to go and see to the cardiologist. He went to see the cardiologist, saved the life.
Thank you very much, doctors. Yeah, go ahead, doctors. Yes.
I have one question actually. See, when we are getting alerts on the app, will the response be in real time or will it take a considerable time?
So as soon as the data that you have, let's say, so it takes maximum of 1 minute. We try to give the alerts in 10 to 20 seconds.
Oh, that's pretty good.
Yeah.
Okay.
Yeah, it's very, very fast, actually. Yes.
Okay. So I think I'll revert to the chat box. There is one question from Mr. MRM Rob from Hyderabad. Okay. Now he says, NGO for caregivers and mentally ill chronic condition disabling carriers of the affected lifelong. So I'm not able to understand Mr. Rao's question actually.
No, there's no
think
question, sir. He introduced himself. So
Okay,
that's it.
he's introducing himself.
Yeah.
Okay.
Thank you, Rao Garu. Thank you, Producer Lakshminarayan. And
Yeah. There is one more question actually.
Okay.
One of the chronic illnesses highly neglected in India is mental illness, like schizophrenia, bipolar, OCD, et al. There are no expert counselors who can bring them to the mainstream of life. Can Two Care Foundation help in this area too?
Um, I'd say yes to a certain level, because we are we already have a lot of specialists on board. We're right now focusing just on chronic care, but as Mr. Mandaraman Rao said, that mental illnesses like schizophrenia, bipolar, OCDs, they're also chronic conditions which need massive care, and they can only be treated by a psychiatrist or a psychologist. And as we build our team, we will have psychiatrists on board, so we'll be able to help with that as well. Right now, we don't have any psychological counselors, but in the near future, we will definitely do that. And this is something that we'll note down. Then, and we'll bring in mental health specialists as well, so that we can also help in chronic illnesses like schizophrenia and bipolar disorders.
Thank you, Dr. Lakshminarayan. And in the interest of the time, we would like to conclude our session, Q&A session. And we would like to move forward with the 1 minute. I think it's jumping the slides. Okay. So this is our gratitude with the thanks to Two Care Foundation for sharing their expertise today and sharing the TwoCare.ai. And we'd like to truly appreciate our founding trustees of Two Care Foundation utilizing the technology and helping the mankind. It's a wonderful initiative. And when Mr. Jitu came up with this idea after his discussion in US, we connected with Two Care and Mr. Saket, and we had a one pre-session also with him, and we came up with this idea of doing for the whole community, whole fraternity. Thank you, Dr. Saket and Rampal and Dr. Diksha, and of course our Dinesh and Dr. Lakshminarayan. We would like to continue with our next session, which is our scholarship announcements. So this has been very wonderful for our patents, for the scholarship sponsors, I can say. Would like to introduce them as well. We have two scholarship programs recipients we are announcing. One is scholarship under the title of J&A BHF Foundation Keval Shanti Student Scholarship Program, which is patronized by the Dhruti Thakkar from New Jersey. And her interest was to support the women health and safety professionals. And this particular scholarship program has been announced by her with the recognition of her grandparents, Keval and Shanti. And we are recognizing 4 students with that. And another scholarship program, which we have Dr. Pravin Patel, Mita Patel, Healthcare Student Scholarship Program. Dr. Pravin ji is from Gujarat, but he settled in US. They have been sponsoring this particular program from last 2 years. This is the second year, I can say. And we are going to announce these recipients of today. Before that, I would like to introduce our scholarship student scholarship chair, Professor Ramana. He has been coordinating this particular program since the inception of the program. And we also have Dr. Lakshminarayan. He's also coordinating healthcare student scholarship program. We'll be listening to them later on. Also, we have Mr. Dakshinamurthy. He's our advocate in Tamil Nadu. He has been coordinating in Tamil Nadu about the scholarship program. But before that, we invited a keynote speaker for today. Mr. Bala will be introducing the keynote speaker. Also, he'll be talking about how HSC profession the career choice for the students, so what are the benefits and other things. So he'll be talking about that. Mr. Bala, please go ahead.
Thank you very much, Ashokji, and namaste to everyone. I'll be very humble and privileged to introduce the keynote speaker for the scholarship program, Dr. Anant R. Sontake. He is the first professor appointed at the National Fire Service College, Nagpur. This is the only college under the Ministry of Home Affairs who takes care of the fire engineering in India. Once upon a time, it is Southeast Asia. Under the Ministry of Home Affairs, Government of India, in March 2024, he earned his BE in fire engineering from NFSC Nagpur, and further his education with an ME and PhD in fire engineering from RTM Nagpur University, become the first PhD holder in fire engineering in the country in India. That's absolutely fantastic to welcome Dr. Anant. He is the chairman of the Board of Studies for Fire Engineering in the RTM Nagpur University. He holds 2 patents, one international and one Indian context. Dr. Anant began his career with the Steel Authority of India Limited as a Maharatna company in Bhilai as a management trainee in fire. During his tenure, he associated to the roles of Additional Chief Fire Officer and General Manager Safety in the Fire Service Department and Safety Engineering Departments of the Bhilai Steel Plant. He was a key driver in a massive modernization and expansion project of Bhilai Steel Plant, valued at 17,000 crore Indian rupees during 2008 to 2022. With over more than 26 years of experience in designing and commissioning of fixed firefighting systems in various projects, fire appliances, process safety, workplace safety, etc., Dr. Anant Sontake has served as a technical expert to several central and state government organizations as a fire safety matters. He has published numerous technical papers in international journals and conferences. He was the chairman of the committees constituted for uniform cadre structure, roles and responsibility of fire and emergency services, recognition of fire training centers across the country. Professor is a member of a Standing Fire Advisory Councils, SFAC, and the Bureau of Indian Standards, Fire Loss Prevention Forum of India, and a life member of 6 prestigious professional institutions. Recently, Dr. Sontake has spearheaded several initiatives, rather I say he's spearheading again, at National Fire Service College, Nagpur, including the development of a Fab Lab, an incubation center, R&D programs, higher education programs, accreditations, and consultancy work in fire safety in collaboration with national and international institutions. I'm very happy to welcome Dr. Anant Sontake on this prestigious platform. Mr. Anant, Dr. Anant, virtual platform is all yours, please. Thank you.
Thank you, Balashrikant. Good evening, everyone present here. Respected founding trustee, Sri Ashok Galrapati, Sri Jitu Patel, various chairs of the J&A BHF Global Foundation, the faces which I can recognize here, Mr. Advi Balashrikant, Dinesh Kumar, and Dr. Lakshmi Narayan, and the humble sponsors to this scholarship program, and the most importantly, the brilliant students who are being recognized today, and it's truly an honor to join all of you. First of all, I would like to express my sincere gratitude to the foundation for inviting me as a chief guest for the honor and for the keynote address for this meaningful occasion. In the privilege to be a part of the ceremony that celebrates the excellence, dedication, and the spirit of the service in one of the most finest field of our time, that is health, safety, and environment. Today, award ceremony is not just the recognition of the academic performance, but celebrations of commitment. The students have chosen this profession where responsibility is immense, where decisions have real life consequences, and where the ultimate goal is to protect the life and property and environment that itself is a noble choice. In the world of the safety and fire or SHE, success is not measured by the technical knowledge or your certifications. It is measured by the awareness, discipline, and presence of the mind and the courage to stand up for what is right. And it is not easy all the time. It is measured by your ability to prevent the accident before it occurs and to lead the calmly to the when all others are panic. The scholarship you received today is more than the financial support. It is a message. The message that your efforts are seen and your potential is respected and your future matters. I encourage every student how to carry the recognition and the pride and responsibility. Let it motivate you to learn more, train harder, and to strive become the harder for this profession. J and Bharat SHG Foundation, I would like to also appreciate your consistent effort in the country as a large as well as globally to strengthen the safety and SHG ecosystem. It's a huge task, and initiatives of yours are supporting the students every year, and they are encouraging with these initiatives. You are not just giving the scholarship, and you are having the safer tomorrow for the country as well as the nationwide. Having working in the Bhilai steel plant more than 25 years in the fire service, where I used to respond for the emergency. I was involved in the protocol jobs, but most of the time I was responding to the emergency when there was already an accident, and the job was to rescue the person or the rescue the casualty. After that, when I after 20 years of the service, then I work in the safety engineering department, where the role was different, and what you had chosen the profession, the same I worked there. Uh, Prevention is always recognized, but it is not easy to stand with to take the strong decisions on the field. The safety professions you work are not always be visible, but impact is precise. That I can assure you. Uh, Talking something about the National Fire Service College, it is a premier institute in the country and producing the fire and safety professional. They are working not only in the country but worldwide in many organizations, many industries. Those are hazardous where safety is of utmost importance, and they have proven their capability there. And I also congratulate once again the all awardees. I wish you best for your future. May you continue to grow the knowledge and confidence and the deep sense of purpose of your academics and your knowledge. And remember, your journey in SHE field is not just a career. It is the commitment to the society or humanity. Thank you once again for the honor, and I look forward for interacting with you all. Thank you. Thank you very much.
Thank you, Thank you, Dr. Anant. Appreciate your insights and encouraging the students. And of course, you have had a wide experience in the field. You can understand how difficult, and as you rightly said, our profession is in fact, it's not only for the bread and butter, but we always community oriented, social work oriented. So thank you for sharing your insight on that. With that, we would like to go ahead and announce the recipients of these two award scholarship programs. First, we'll be announcing the scholarship program of Keval Shanti scholarship program. And that's, you can see here, the nice flyer has been prepared by our chair for HSC Digital Tools and Innovation, Mr. Prabish. And nicely it has been uploaded in our website by Mr. Makbul, chair for the social media and website. I'd like to congratulate Maithili Chinta, Ms. Khatula Shivani, as well as Armugam Abhirami from Tamil Nadu, and Ms. Syed Shaheen Akhtar Banu from Telangana. So we would like to give an opportunity to these students who have been recipients of this award to say a few words, to listen to them from them, the few words from them. Let's listen from Maithili Chinta first. You can unmute yourself, Maithili, and speak for 2 minutes maximum. Please go ahead, Maithili. Yes.
Respected trustees, members of the J&A BHF Keval Shanti Scholarship Foundation, distinguished guests and well-wishers. Good evening to everyone. I am Maithili. I am truly grateful and deeply honored to receive this scholarship today. I want to sincerely thank the foundation for recognizing my efforts and believing in my potential. Your support means a lot to me. For me, this scholarship is not just a financial help. It is a big encouragement and a reminder that I am on the right path. As someone who wants to work in occupational health and safety in the construction sector, I understand how important and challenging this field is. Your support gives me even more strength and confidence to continue my studies with dedication. It inspires me grow, learn more, and work hard towards creating safer and better workplace everyone in the construction sector. The J&A BHF Keval Shanti scholarship is truly a light of great motivation for students like me. It shows that commitment is valued and that there are people and institutions who genuinely want to help younger learners grow. I feel proud and humble to be a part of this legacy. I promise to use this opportunity wisely, with sincerity and responsibility. In the future, I hope to contribute in a meaningful way by reducing risk, improving safety culture, and helping workers lead better lives. And I would also sincerely thank my institute, the National Academy of Constructions, for providing me a wonderful learning environment and for guiding me with experienced and supportive faculty members. And lastly, once again, from the bottom of my heart, thank you for this honor and trusting me. I am truly grateful. Thank you, sir.
Thank you, Maithili. Very, very inspiring. And of course, you need to give it back to the profession, as you rightly said. Let's move forward with Kathula Shivani. I'm not sure she's there. Armugam Abhirami.
Thank you, sir.
Okay. Who is
Respected trustees.
This is Abhirami. Shivani. Who is speaking?
Shivani.
Okay,
Shivani,
go ahead. Go ahead, Shivani. Yes, go ahead. Yeah.
Respected trustees and members of the J&A BHF Keval Shanti Scholarship Foundation and well-wishers. Good evening to everyone. I have completed my construction safety course in NAC Institute. I am truly honored and grateful to receive this prestigious scholarship. This scholarship means a lot to me, not only as financial support, but as recognition of my hard work, dedication, and passion for occupational health and safety. Safety is the one of the profession because it saves lives, protects people, and teaches us the responsibility that comes with our role. Your support motivates students like me to move forward with confidence in this meaningful field. I would like to thank my institute NAC providing quality learning. My sincere thanks to our director Rajareddy sir and Ramana sir, Ravi sir and Murali sir. Once again, I express my sincere gratitude to the J&A BHF Keval Shanti Scholarship Foundation for this honor, for supporting students like me. I am grateful to share this evening with all the respected and inspiring persons here. Thank you so much for this opportunity.
Thank you, Shivani. Appreciate your remarks here today. We'll go ahead with Armugam Abhirami or Syed Shahin Akhtar Banu. I saw the Syed Shahin Akhtar was on the call.
Syed was there. I saw that.
Yes. Maybe she's on the mute. Okay, no problem. So we will continue with our program, and going ahead, we will give an opportunity to listen from our facilitators, Professor Ramana, Dr. Lakshmi Narayan, and Dakshinamurthy, and of course our Mr. Jitu Patel. Before that, we would like to go ahead and announce the next scholarship program. Of course, these are the certificates where our students will be getting along with the scholarship check. So Professor Ramana will advise us how he is going to hand over to you. So that's Maithili, Kathuli Shivani, and Abhirami, and Syed Shahin Akhtar Banu. Now moving ahead with the next scholarship program, which is J&A Bharat HSC Foundation, Dr. Pravin Patel, Mita Patel, Healthcare Student Scholarship Program. And this is being given to 4 students again, mostly the healthcare students, starting from Veera Kaila Rajita from we'll be seeing the college name and other things, Sapi Pushpalata, Sunkara Madhuri, and Vibhuti Mamata. So we request Veera Kaila Rajita to say a few words. Veera Kaila Rajita.
Good evening, respected dignitaries, mentors, and the members of the J&A Bharat HSC Foundation. My name is Rajita, a BSc Nursing graduate and currently a nursing tutor It is a great honor to stand here as an aspirant of the J&A BHF Foundation Scholarship. First, I sincerely thank the Foundation for recognizing students in the healthcare field and for creating opportunities that motivate us to grow further. Your commitment to empowering young professionals truly inspires us to aim higher in our careers. If I receive this scholarship, I assure you that I will use it honestly and purposefully. It will support my academic goals, especially as I plan to pursue my MSc Nursing soon. I also plan to pursue MSc Nursing soon. I also intended to invest in essential educational tools such as laptop, which will be help me in teaching, research work, online learning, and professional development. This scholarship will not only support my education, but will also strengthen my commitment to contribute positively in the healthcare and HSC. I aim to uphold safe practices, promote quality patient care, and continue to update my knowledge to serve better a healthcare professional. I once again express my sincere gratitude to the J&A BHF Foundation for this opportunity and for encouraging students like me to move forward with confidence. Thank you.
Thank you, Rajita Garu. It's congratulations once again. And we'll go ahead with the next Sapi Pushpalata. Please go ahead and say a few words.
Good evening, sir.
Good evening.
Good evening, all dignitaries who's they are present here. I'm very much thankful to talk now. Thank you so much, sir, for providing this scholarship to the selective students. Sir. This is very, very helpful to each and every student. And thanks for your help and also. I'm really heartful thanks to J&A BHF Foundation. I'm very happy to share my words to you all, sir. This is means me a lot, and I'm thanks to my college. Actually, I was done with my MSc in medical surgical nursing, Government College of Nursing, Somajiguda from Hyderabad. With this scholarship, I'm going to continue my further studies, and it's helped me a lot. And sir, thanks for this scholarship and support, and please do support in next coming generations also. It is very, very, very helpful, sir. Thank you so much. Thanks to my institute and my ma'am Sunita Madam Garu and all J&A Bharat HSG Foundation. Thank you, sir.
Thank you, Pushpalata, and appreciate your decision to improve your career. All the best and keep supporting the community. Thank you. Let's move forward with Sunkari Madhuri. She is a Bachelor of Students in Nursing, Nursing and Midwifery from Government College of Nursing, Hyderabad. Sunkari Madhuri, are you there? Okay. Next, we are going ahead with Vibhuti Mamata. She is doing a diploma in General Nursing and Midwifery from School of Nursing, Gandhi Medical College, Hyderabad. Vibhuti Mamata, are you there? Okay, so let's going ahead. Yeah. So with that, we would like to listen from our Professor Ramana and how he is planning to hand over these certificates and scholarship programs to the students. Professor Ramana, please go ahead, sir.
Yeah. Before I explain to you the way I am going to distribute the certificates as well as the checks that I have not yet received, I will be receiving shortly. It is getting tracked. It will be handed over to the respective colleges in the presence of their administrators or principal, whoever is available. So that this is what we have done in the last term. Same thing will follow this term also. I am in touch with all the students. There is only one student from Chennai, Veltech. I think it has to be sent to Chennai, our foundation, who can hand it over, like what they have done last year.
Yes.
Barring that, all the other institutions.
Yeah,
Dakshinamurthy. Barring that, all the other institutions are in Hyderabad. I and Lakshmanarayana will be personally going and distributing the check, also in the presence of their principal or coordinator or administrator, whoever it is. Anyway, from my side, it's a respected founders of J&A BHF Foundation, esteemed sponsors of the Keval Shanti Scholarship, and Pravin Patel, Mita Patel Scholarship, distinguished faculties, honored guests, dear parents, and all our proud awardees. It's my profound honor to be with you all in the online global event today as a chair of student mentoring and scholarship. My side, I am myself Professor Ramana on behalf of J&A Foundation and the meritorious students who have successfully completed their professional journey in occupational health, safety, medicine, and nursing. I extend heartfelt gratitude to this remarkable foundation and its generous benefactors. The Keval Shanti Scholarship and the Pravin Patel and Mita Patel Scholarship embody compassion, philanthropy, and a vision that human well-being must remain at the heart of progress. We deeply appreciate this noble mission. To our beloved students, this honor brings responsibility. May you carry forward the values of service, empathy, and professionalism. Let every workplace you touch become safer. Let every life you care for be treated with dignity. So, on behalf of our foundation and the future of occupational health and safety, I offer my sincere thanks to J&A Bharat Foundation and the gracious donors. Your contribution will be remembered by both the students and their parents you supported, but in every life, these professionals safeguard. With deep respects and gratitude from my side. Thank you.
Thank you, Professor Ramana, for really supporting our event. It is not an easy task to announce the program, receive the applications, evaluation, and handing over. It's a big task. Dr. Lakshmanarayan Prodhuchur, would you like to say a few words, sir?
Yeah, Professor Ramana has already said whatever what I wanted to speak. It's nothing but just a small, reciprocate what Professor Ramana said. Whenever the checks come, it will be about a week or two. Once those checks come, we'll personally come to the colleges, institutes, and hand over the checks to the students in the presence of the principal or the faculty who have facilitated all these things. So that's all I want to say, nothing more. Thank you so much.
Thank you. It's already been dispatched. Yes, it has already been dispatched. I think it will be reaching tomorrow or the day after.
Oh, that's good. Yeah. Thank you.
Mr. Dakshinamurthy, would you like to say a few words?
Yeah, thank you, Ashok. As usually, last 2 years, the Welltech Engineering College students are getting the award, same type of awards. So this time also will go. There is we will organize small function, and the vice principal and everybody will be the HOD. We will contact with the concerned person and hand over the check with the minimum people down.
Great, thank you.
Okay.
And I have seen Raja Reddy, Dr. Raja Reddy from NAC, National Academy of Construction, was on the call, but I'm not sure. Mr. Raja Reddy, would you like to say a few words, sir?
Yes, good evening, gentlemen. I would like to say thanks to J&A Bharat HSC Foundation, J&A Global HSC, and I express my profound gratitude to Pravin Patel, Ms. Mita Patel, Jitubai Patel, Ashok Garlapati, and Triti Thakur. Professor Ramana and Lakshmanarayan. Professor Ramana is instrumental, bringing, because he's our faculty as well, and is former director of NAC, and is doing wonderful job. And I also congratulate Maithili Chintala and Katula Sivani for their scholarship, and I also congratulate all other recipients of the scholarship. And in fact, the safety is paramount important in the safeguarding the human life, and because you can build anything, but you cannot bring back. The God is not given us to build a life which is lost. So is most privileged job, but least bothered in India. But we should still insist. As I worked in UK in when only 2 accidents happen in the country for a year, the whole parliament was stand still, and they have debated the whole week to reduce the even 2 accident in whole year. But in India, lakhs of people are dying due to health and safety. Lakhs, and it is most important, for India to progress well. We've been talking last time, we met.
Yes.
Yeah, so we wanted to take it further. In fact, we would have exchanged an MOU now, but in fact, even Professor said we'll have another a groundbreaking ceremony to to exchange an MOU. We are ready to do that, and we wanted to enact. We wanted to establish a health and safety, a lab or health and safety park for bringing out more sustainable, safety trainings for the construction and other fraternity. Okay, and thank you, for giving this opportunity in this evening, and I welcome again, for the mutual beneficial associations with you. Thank you very much.
Thank you, Raja Reddy Garu. It's pleasure talking to you again. So it's always we'll be glad to collaborate with you through that MOU. We'll have another gathering as well, especially for that MOU. Thank you so much.
Definitely, thank you.
And it's almost our time is running out, but we would like to thank our financial donors who have been supporting our foundation in the Bharat as well as in the global. These are our knowledge donors as well, like 2Care Foundation. This is the 44th OKT. So imagine we have been doing every month, and those are the knowledge donors. These are our ambassadors through J&A knowledge WhatsApp groups, sharing a lot of information round the clock. And just join hands with us, and we have a next upcoming program on India Labor Code, which has been recently announced in India. So we'll be talking and more dates, and the speaker will be announced shortly for that. And we would like to listen from Mr. Jitu Patel before we hand over to our vote of thanks, Mr. SPB. Mr. Jitu, please go ahead.
Thank you, Ashok ji. I know it's very late in that part of the neck of wood in India, must be nearly or even gone past 10 o'clock at night. So I'll be quick and brief to say that the topic of managing chronic conditions is a very vast and involved with in-depth knowledge with varying specialties. That is extremely difficult to summarize in a concise time that we had given to these 4 magnificent speakers. Despite that, they did a wonderful job, and it was very clear that they gave the importance of regular early checkups to avoid becoming the victims of chronic conditions. And they alluded that around in our country, India, 430 million people suffer from these chronic conditions, and out of which 3 of 5 die with this suffering, which is a very high number. And I want to just say thank you to all the 4 distinguished physicians in healthcare medical profession for contributing their knowledge and expertise. Going further, I just want to say that Professor Anand Sontek, he was outstanding, and he spoke the heart out of my mind, that encouraging, inspiring the young people to be really something with a full commitment to not only just the society, but also to the country to do the right thing. I applaud to Professor Sontek for his profound vigor, encouraging keynote. And last but not least, I just would like to say these students, girls, they really are outstanding. They are truly the new Bharat citizens. And in fact, we will not say them anymore students, but they are the citizens who really will take our flag and make all 1.4 billion people feel proud of them with their visionary commitment. And with that, I thank you for giving this opportunity to say hello to everybody, and what a wonderful people we all are. Thank you.
Thank you for your comments, Jitu Saab. And we have with us Mr. SPB. He's our advocate as well as a fire and safety community awareness chair. And he is based in Andhra Pradesh, Vizag. Mr. SPB, thank you for accepting to deliver our vote of thanks for today's guests and as well as the recipients. Please go ahead, sir.
Thank you, Ashok ji. On behalf of J&A Bharat HSC Foundation, I, SPB Rangacharyalu, Chair for Fire Safety Awareness, present the vote of thanks. So first, I would like to thank Ashok ji for his opening address, and also I want to congratulate you for the award, the BCSP award, and also introducing about the entire J&A BHF Foundation activities. So, and also I thank our Jitu ji for his welcome address and building this platform, J&A BHF Foundation platform. The membership just 12 short of 600. With another 1200, it will be 600. I really congratulate both Ashok ji and Jitu ji for this excellent job of bringing so many HSC professionals on a single platform from around the world. And also I thank Dinesh Kumar ji for introducing 2Care Foundation speakers. And I would like to thank 2Care Foundation speakers, Dr. Saket Toshiwal, Dr. R. Rampal, Dr. Diksha Sharma, for their awareness on managing chronic conditions through nutrition, health records, coordinated care, remote patient monitoring, functional nutrition, inflammation and oxidative stress as a core mechanism. And also, I would like to thank Dr. Lakshminarayana for his moderation. I thank Bala Siva for introducing our keynote speaker, Dr. Anant R. Sontake. So we thank Dr. Anant R. Sontake for his excellent keynote address. And we'd like to congratulate all the awardees of the scholarship, Maithili, Shivani, Abhirami, Bhanu, Ranjita, Pushpalata, Madhuri, and Mamata. So I want to thank all the sponsors, Dhriti Thakur and J&A BHF Dr. Pravin Patel ji, Mita Patel ji, for sponsoring these programs. And I want to thank Ramana ji and Lakshminarayana ji for implementing this scholarship program. And I thank you each and everyone, all the members here for patiently being here for so long. Thank you all.
Thank you, Dr. SPB. And it was when you were reading out the names of the awardees, we felt so happy. This year, all the women award recipients, so it's truly appreciating, as our Prime Minister always says, women power. So truly we encourage that and appreciate today's award recipients. And with that, we would like to always Mr. Jitu says, open your cameras for the picture. So let's see. Can you open your cameras? Let's see.
It would be nice if everyone opens the camera, including all the magnificent, highly awarded, as I said, I will not say them students, the recipient of the awards.
Great, excellent. Anybody else trying to open? Okay. Let me take the second screenshot. Okay, let me take a second screenshot. Yes. Okay, that's good. Thank you so much. And with that, we would like to congratulate.
Little socialization.
Socialization. And any further remarks? And let me stop the recording. Then we can have the socialization.
I will go first, and I would like to share to all the medical